Okay, I think I'm all set up, Sarah. Let's have my
Fabulous.
crossed and we'll see how we go. So let me introduce you for people that don't know you, because I know you well because we work mutually with a lot of clients. But this is Sarah George, and Sarah is an acupuncturist and Chinese medicine. Is it doctor or practitioner? Doctor. Chinese medicine doctor.
Practitioner. Yeah.
Based in Launceston.
Hello.
And so I wanted to have a good chat with Sarah today around fertility and pregnancy. And before we even jumped on, together on this live, we were saying that even though we work mutually on patients, the way we look at the body and talk about things is different to each other. So I thought this was a really good way for people to learn more about how Chinese medicine can support them in their fertility and pregnancy right now. So thank you for joining me.
My pleasure. Lovely to be here.
So tell me, how did you first start getting interested in Chinese medicine? Like as a kid, did you go and see an acupuncturist, or I actually don't know. How did you get started?
Yeah. So I was just chatting about this yesterday, actually.
Oh,
When I was growing up, my mum had lots of autoimmune diseases, and so she was doing Western medicine testing and seeing Western medicine doctors and specialists associated with that. But she was also seeing a naturopath. She was getting Chinese herbs. She was going to an acupuncturist. She was going to a lot of different health professionals to help with different aspects of the problem. And so that might have helped her take a drug that she couldn't take because of the side effects. So she was very well informed. So she'd look into the drug. Do I want to take this? And I think I do want to take this, but I can't manage the side effects. And then she might use naturopathy or acupuncture or something like that to help manage the side effects. And then there are other things where she's like, no, I don't want to try that. I think there is an alternative to that. And then she'd choose a naturopathy or acupuncture or Chinese medicine or one of these things or all of these things to support her through that journey. So then when we were growing up, if we were unwell, we really only went to the doctor if it was something that the doctor could help with. We need a medical certificate, or there was something that needed to be tested or looked at in more depth. But otherwise, for a cold or a flu, you were just straight off to whoever could help you, and that might be the acupuncturist, or get some herbs, or go to the naturopath. Or I was saying, I'm sure I took Western liquid herbs before I was 10, and I definitely had acupuncture before I was 15. So I was right into all of that, and she was a great cook, and we were always going to Chinese supermarkets and Middle Eastern supermarkets and things like that, and looking through the herbs and the interesting things and that sort of stuff. So we always used a lot of that at home in our cooking and our diets and those sort of things too. And then when I finished, actually in high school, I got away with doing aromatherapy instead of sport in grade 12.
Really?
Yeah. Which suited me really well.
At school?
And at school,
Really?
yeah. So I was doing aromatherapy and loved it. And then I thought I'd like to go and study natural medicine when I left school, and I picked up a brochure for the Australian College of Natural Medicine, which is in Brisbane, and then I thought, oh no, that's not a real job. And I went and did a business degree at UQ. And
did you like that?
So I did marketing at UQ, and I worked in the wine industry first of all, and then I decided after that I'd like to work in the health industry. That was where my real interest was, and so I worked for Sunspirit Aromatherapy down in Byron Bay, and I worked for a few other natural medicine companies, and decided that I could do my job better if I understood how the body worked better. And then that's when I decided to go back, and initially I enrolled in naturopathy, and then I was going to see a naturopath and an acupuncturist at the same time, and chatted through both of them and was convinced that I should go and do acupuncture instead.
I had no idea of that story. That sounds like a pretty good excuse to me. Like I should get to know the human body a bit better to help me in my marketing job.
How are you going to write a brochure if you don't even know how the body works? So, and it was always with the intention of going back to marketing, then I just fell in love with acupuncture, and I had some teachers who put me in touch with some great naturopath acupuncturists in Brisbane to work in their clinic.
And you focus on women's health and fertility and pregnancy a lot in your practice. Is that just something that you just kind of, worked in general health and fell in love with those particular areas? Is that how it
Yeah.
looks like for you? Yeah.
Yeah, it was. So it was actually that clinic that my teacher had recommended that I go and work in this clinic with these two great practitioners. It was on, if anyone knows Brisbane, it was Spring Hill area, where there's a lot of hospitals and medical specialists in that area of Brisbane. And we had 3 IVF clinics in the local area that you could walk to our clinic from. So
I can imagine you had a lot of like post-transfer and pre-transfer.
Absolutely. So
Yeah.
first year out from first year out from college, and I had these great practitioners to learn from, and 3 IVF clinics around, and I just really fell in love with treating women and couples who were going through these fertility procedures, and just I felt needed a lot more support and understanding and listening. And I loved my role in doing that. So I'd say probably a third to half of the people I saw at that clinic were somehow fertility or pregnancy was why they were coming to see me, and maybe about half of them were through IVF. Yeah.
Okay, so I kind of guess I would like to touch on 2 different topics with you to pick your brain.
Sure.
But what are you seeing right now in both areas? So like fertility and pregnancy. Are there like common like stumbling blocks or roadblocks or anything right now in people's journeys? Is it just because IVF clinics have been on hold? Looks like they're starting back up again, but is it the stress of that, or have you seen anything different in the last month, or for you, the last month and your clients' concerns is very much the same as it always has been?
No, I think it has been a little bit different, because I think the normal support networks have not been there, or not been there as much, not as accessible, perhaps. Also, for some people, maybe more accessible with things like online. But I think I see a lot of people who come to see me weekly, and it's a check-in and things that mightn't seem important enough to call me and tell me about, will come up just in a weekly chat, and we can go through those and talk them and work out how we might work around that, or is that okay, or work with even tiny little things that might make someone just feel a little bit happier, or feel a little bit more like they understand what's happening, or something like that. So I do think there's been a lack of connection to some degree at the moment. I think probably from this year, I think Tas IVF's decision to not do embryo transfers and pickups in Launceston, I think there was already a little bit of anxiety around that already. That said, I think down in Hobart there's probably some extra services that can be accessed. So I think there's pros and cons to that one, but I do think that was a bit anxiety provoking for some people.
And I can only imagine too, with people that you're talking about, there's the impacts of stress and worry and fear and that kind of thing. Let me pick your brain about that. Is there a common way in Chinese medicine that we look at that? Like, are you seeing that impact people in their overall health and in regards to fertility and pregnancy? Would you say that impacts them in a certain way?
Absolutely. So Chinese medicine places great importance on the heart. And the heart is considered the emperor in Chinese medicine. I say sometimes the empress. The heart is said to call all the shots in the body. So it's said to tell all the other organs what to do. And then through the blood circulation, it has to listen to anything that's going wrong in any of the organs and feed that back to the heart. So the heart's got to listen and give good orders. It's got to be a good emperor, you've got to have someone who's willing to not be a dictator. They've got to listen, and they've got to give good advice back. Now, the heart in Chinese medicine, we associate with the mind as well. So mental health goes with the heart. And it can just be that you're a little bit stressed. That still goes with the heart. So anything that affects your mind, where you're feeling a bit more stressed or you're feeling a strong emotion, will have an impact on the heart. And more like it's a general connection, this heart with all the organs, but there's a really specific connection between the heart and the uterus. In Chinese medicine, they said there's a little channel that goes down here, and the heart and the uterus. So basically, this is where, when stress affects your cycle, this is where you've had a trauma or a big stress and your period has come late, or there's been something that's changed in that cycle because of a stress related thing. And so we look at that as that heart uterus connection. The other connection is the uterus to the kidneys, and the kidneys in Chinese medicine are more to do with things like your DNA, your genetic matter, your eggs and well, we're talking about uteruses here, so not so much sperm, but a similar concept in men. So this is more to do with maybe pure, maybe age-related hormone changes that might then affect the frequency, like going through menopause, affecting the menstrual cycle. But the heart is not that side of things. The heart is different. This is more what's going on mentally, emotionally, spiritually, and how's that affecting the way the uterus is working.
So then does that mean that regardless, forgive me because, I'm no expert in Chinese medicine at all. In fact, like I said, we look at the body really quite differently. But then would that mean that, so I'm learning just as much as anyone else watching this, does that mean that if you pick up that there's that heart uterus connection, whether or not someone is trying to conceive or whether or not they're already pregnant, you still would work on it in a similar way? Or are there really different things that you need to work on when you've acknowledged or seeing that connection is something that's impacting them?
Yeah, I think probably yes to both. We do it differently and the same. So in fertility, really, we're looking at these cycles. How are the cycles working? We want a lovely, regular cycle. We want the right things happening, ovulation happening at the right time, these sort of things. Stress can impact that. So then we'd look at ways we can mitigate stress in the lifestyle, and things like meditation and things like that come in. Chinese medicine, Chinese medicine is not religious in any way, but the development of Chinese medicine in China, there were different religions that influenced the direction Chinese medicine took. So there was Buddhism, Taoism, and Confucianism. And so there's a little bit of those theories that do, or philosophies that do filter in. So the Buddhism brings some of the meditation side of things. And so meditation's always been a part of Chinese medicine. Mindfulness, comes from Buddhism. So this control of the mind and working with the mind, and if emotions are too strong in any particular emotion, it's about, well, how do we work with that to then and return to a calm? And they talk about things like for everything to work well, it's a little bit like water with ripples in it. If you can't quite see your reflection, then it's hard for everything to do what it's supposed to do. Like you need the calm for everything to settle in the water, and then you can sort of see what needs to be addressing. Whereas when it's all going like this, it's very, very hard. So, and given that well, what we know now about neuroscience is the brain calls lots of shots that happens in the body. So Chinese medicine sort of has these ideas which sometimes sound a bit weird, but the more we're learning, then the more there's this overlap that then kind of things like gut and brain has always been a big thing in Chinese medicine. What we know about that now is
it's
really
completely backed by science.
Yeah, that's it. So in a fertility sense, keeping the body very calm, but also, things that we know about, stress can cause problems with conceiving. So we want to reduce stress. So we can do that through things like meditation and reducing sources of stress and that sort of thing. But also acupuncture, we use particular points. There's points in the body that help to release endorphins and make you feel good and that sort of thing. A lot of people who've had acupuncture will come in, and even if they don't really like needles, usually they leave feeling really good, like a weight is lifted or something like that. So the actual acupuncture itself focuses on that, but there's particular points we can use where we need to do more of that for someone. Because some people come in and really they're not stressed at all, but for some reason their body hormonally is not working properly. It's not a stress thing. It's a genetic thing or some other factor. So it's about working out, what's going on and how much of is stress or emotional problems or mental problems contributing to that person, and then finding the right treatment to affect that. Now, in pregnancy, again, we look at the same thing. So stress can impact on how the organs are working. That can cause problem, but probably that becomes a real, well, really we'd focus a lot on that in the first trimester. And also, particularly if there's a history of recurrent miscarriage. In fact, there's some excellent research that just says supportive care should be considered as a very big treatment for recurrent miscarriage. And I think no more research needs to be done on that topic. It is very conclusive that if you've got someone you can go and see at any time, the same person, you don't need to tell your story again, that in itself has shown to be helpful for women who have had recurrent miscarriage. But at the other end of the cycle, pre-birth, again, that's another time where stress can be problematic in encouraging a nice healthy birth. And you would know all about that, Jacqueline, through your hypnobirthing courses. But that's another time where I'd be very focused on what is stress like for that person, and how can we work with that. And I probably would also add to that too, that in Chinese medicine we have different emotions attached to different organs, and so some people might be real overthinkers and will treat that differently to someone who maybe is experiencing sadness or grief or holds on to that kind of emotion, or is really driven by fear, or is more easily irritable or frustrated or angry or resentful. So these different things, or has trouble finding joy in things, or is always way too elated. These sort of things will all affect, you know, how the rest of the body is working. We're not a separate mind body. We are together. But that said, the mind isn't the problem for everyone either.
And of course, we both look at the person as an individual. Like no two people, going to have the same physical manifestation or mental manifestation of a similar circumstance. And I guess, like right now, even though, and I don't know that everyone's experience really is the same. I think everyone has a lot of different stuff that they're dealing with. Even there's just stuff that people are dealing with generally. But I guess from what you were just saying, then you might see propensity for that to impact different organs in different people. Is that right?
Yeah, that's it. So someone who's always very frustrated and irritable, and look, some of us are like that from time to time, or some people are just feel more dominant towards that. We say that affects the liver in Chinese medicine. Now, all the organs in Chinese medicine are quite different to their Western medicine counterparts, so don't think they're the same thing, although they can have overlap. So the liver in Chinese medicine, we say, has a lot to do with regular cycles in the body, and particularly PMS type symptoms. So the liver just gets stuck really easily. And when I say stuck, we like nice free flow in the body in Chinese medicine. And when there's stuckness, we might have tight neck and shoulders. We might get headaches easily, but we get the sore breasts. We get the food cravings before the period, the breakouts, like all of this sort of thing happens. And that's more this sort of we call it liver qi stagnation, but it's just saying that the liver's not moving well, and you feel better for movement, worse for being still, but also you don't want to move because you just want to, you know, be a blob basically when you kind of like get comfortable like in your little blob. But you also, if you went for a walk and you'd come back, you know, I feel so much better now, why didn't I do that before? And you're like, well, because that condition is making you just want to do that. So then when I use like a liver herb, or my herbs that work on the liver, is that similar to if you were working with a Chinese herb? Would we be thinking along the same lines, or are we going to be thinking very differently then because of the way you're viewing the liver? You know what I mean? Because I could match up with that, like what you're saying. Well, I could say, well, maybe some of these things are more estrogen dominant or estrogen dependent, and they're working on the liver clearance of estrogen. You know what I mean? Like I can see how I could match that up. But would we look at that really differently? And use a herbal medicine really differently to that? I think there's that overlap again. So some of it will be different, some of it will be the same. So we love bupleurum. as a liver herb in Chinese medicine. Chai Hu is its Chinese name, and it's said to really help move the liver along. It's a little bit pungent, it's a little bit clearing, but we wouldn't necessarily use all the Chinese medicine liver herbs to maybe work with maybe someone who has hepatitis or some of the other maybe liver conditions. So while there's overlap, it's not necessarily apples and apples.
Yeah.
And
it's fascinating. It's so interesting.
Yeah, it is really. It is really. Probably the biggest one that's different is the spleen.
Okay.
In Chinese medicine, the spleen is nothing at all alike to the Western medicine spleen.
To what we think of the spleen. Yeah, okay.
Yeah, so the spleen in Chinese medicine is more about digestion. It helps you to hold your blood. So that means if you have lots of spotting or leaking of blood or varicose veins, the spleen's not doing its job of keeping blood where it should be. It gives you a bit of energy, but it's really about digestion and making blood as well. So pulling nutrients out of food too. So it's really not at all like the Western medicine spleen. So
spleen,
can
so
be
just
quite
from what
different.
You're saying then, is that postpartum? Do you think of the spleen postpartum?
I think of the spleen almost all the time because
what I meant was when you were describing that, that's what the first thing that came to my mind was, and I was wondering, am I interpreting that right?
Yeah, you are. So you could think of it as menstrual periods that are just sort of like a slow, long leak or long spotting. Or you could think of it postpartum, absolutely. And there's many other, just anyone, especially if it coincides with digestive symptoms, especially loose stools, especially a bit tired, that would be a spleen picture.
So can you give any tips? Because right now, at this particular point in time, I know that you're not doing acupuncture, and hopefully it comes back and you are able to work, hands-on with people right now. So what does it look like? How does working with someone like yourself look like now when you're not doing acupuncture? Is that then someone would know a herb to take, or that you're working with their diet? How would you use this information, incorporating it now?
So a lot of people don't know this because I think we're not very good at spreading the message. Chinese medicine's made up of many different modalities. So acupuncture is one. We've got Chinese massage, we have herbal medicine, we have dietary therapy, and we have exercise and lifestyle as well. So all of those things form Chinese medicine. Now, at the moment, we're not doing acupuncture as such, just due to social distancing and safety for my patients. I'm concerned for that. Hopefully not very much longer we'll be able to get back into it. But I am teaching acupressure, and look, there's excellent research out there on acupressure. There's been UWS did some research with period pain and acupressure. And I think they were developing an app. I'm not sure where that's got to, but they were developing an app associated with that. So some really good acupressure can be done at home every day. It's cheap. It's free, in fact. We also have something called moxibustion. Now, I don't normally recommend moxibustion to anyone who hasn't had it in clinic, because I think it's important to sort of know what it's like before you start doing it yourself. But basically, it's a herb. It's mugwort herb. It comes in a stick. I should have got a stick out for you. But it comes in a stick about that long. We get smokeless and smoky types, but basically we just hold it near an acupuncture point and put warmth in. And some of the things that you've probably heard it.
I have, in terms of the women that I'm working with, birth prep, all that kind of
stuff.
Right?
Yeah. So it's well known, people know it well because it's often used for helping to turn a breech baby.
If only if it was just that simple though too, right?
It is. I always combine it in with an acupuncture.
Yeah, that's what I mean. But it'd be nice if it was just that. Like if we just could use something like that. A little breech baby that,
Yeah.
A lot of I know that some of the women that have done my hypnobirthing have been to you for that. And so that is the place where I have heard of it the most.
Yeah.
But a lot of other ways.
Oh, lots and it's used. It's older than acupuncture. It's can be used for so many things.
So would that mean that there were different excuse my ignorance because I don't
No,
understand this.
no, good
Does
question.
this mean, so like in a part somewhere in China that moxibustion was a really common form of therapy, and
Yeah.
then somewhere else they might have started using needles and acupuncture? Is that, has
That's
that kind
right.
of,
Yeah. Different regions were big on different things. Um, and different types of herbal medicine started in different regions as well. So the cool climate parts of northern China started up with more herbs that they considered most diseases were caused by cold. And then they branched out in the body to cause all sorts of different symptoms, but it always started with cold. So the herbal strategies were all about getting rid of cold or warming the body up. In the south, much later on, a warm school developed, and so it was all about warm gets in the body and causes problems, and so how do we sort that out? So yes, different regions of China had different therapies that arose from those areas, but basically channels came, so you've seen those pictures of the channels with the points on them in the body. Basically the channels came first. So they were lines, and in terms of acupuncture, really it was just using the elbow creases, the wrist creases, that sort of thing, and mostly they just bled those points. And then later it was points that came onto those channels.
Okay, so sorry, I led you down different parts. So you said like at the moment you'd be using acupressure.
Yes, acupressure. I do a bit of moxa. If you've had moxa in my clinic before, I'm really happy to talk you through moxa and give you some points. I've got some great handouts on how to do that nice and safely, and so you know where you've got to do it.
Do you do
and
it
that sort of thing.
yourself, or does someone do it with your partner?
Mostly you can do it yourself. The ones for when we're doing breech, it is much handier if you've got someone who can help you with those ones, access those points. And then Chinese dietetics. Chinese dietetics is an area I love working in. So we talk about, rather than carbohydrates, proteins, fats, and magnesium and zinc and that sort of thing, we talk about foods that make you feel warm or make you feel cool, foods that moisten, foods that dry, foods that drive your qi upwards or downwards. So let's say you've got diarrhea, you don't want foods that make your qi goes downwards, you want foods that bring your qi upwards. If you've got bad headaches, you don't want foods that make your qi goes upwards, you want your qi to go downwards. Same with reflux vomiting. It's about just moving the qi in the right direction. So some foods do that differently. And then the foods that nourish blood and tonified qi and that sort of thing, and foods that work on different organs. So foods that
Can I pick your brain then about morning sickness? So what would you do for vomiting with morning sickness? Is that like when you said that's because you need to, is that you need to move the qi down, or that's something totally different?
Well, it depends, because we sort of take morning sickness and we divide it out into maybe 8 different types of morning sickness, depending on how the person is presenting. So you might, some people have got all day sickness, some people it's just morning sickness, some people are better for eating, some people are worse for eating, some people one food will cause a massive problem and others that food is fine. So they're all a bit different. My general go-tos for morning sickness is to work out if they're presenting more warm or cool. If they're more cool, I usually go for ginger. If they're more warm, I usually go with mints, peppermints, citrus, that sort of thing. So I'm like, do I need to warm this person up or cool them down? And then we have this concept of full or empty. So some people are just so tired and depleted, and we see a lot of those. It's women who are working, they've got other children, so much is going on, they're just really depleted. So mostly those types of women need to be built up, and we might use, depending on what she's able to take, like sometimes just eat whatever you can, just do whatever you can. But where there is a bit of choice, we're looking at putting really good nourishing foods in. Now, other women might fall into an excess category or a full category, and that's more like they feel full. This is all full. It feels stuck, there's stuckness here. They're worse when they put something else in. And so with that, then we want to look more at how can we clear this out. And so that's more a process of moving and trying to get this area moving better. So we're clearing, eliminating, but we're probably taking out anything rich, heavy. We're using things like bitters and that sort of stuff. So kind of two different things. One person we're really trying to nourish and build up, and the other person we're like, you've got too much. Let's move it all out.
Is that the
Yeah.
same as reflux during pregnancy?
Yeah, it would similar, very similar.
Yeah.
Yeah.
Oh, it's
Yeah.
fascinating.
Yeah.
Okay. And so what else? Is there any other ways that people would access this from home, or they need to work with it with someone like yourself who would give them like a plan on what points to use or where to use the moxa or what foods to eat? It needs to be very much individualized for a person?
Yeah, to do Chinese medicine as it was truly meant to be, and to get the best results, I think it is worth being individual, because Chinese medicine, when we go back to foods, it's never about soy is good or soy is bad or goji berries are good, or it's not never ever meant to be like that. It's all about this food has this property, and for you right now it's good, but maybe next week not so good.
Which makes
Or while
sense
you've got a
because we're
cold.
changeable.
Yeah, that's exactly it. Yeah. So when it comes to treating yourself, you need to understand your Chinese medicine diagnosis at that point to then be able to, it all flows from there. Diagnose well, then work out what it is we want to do from that diagnosis, and then find the treatments, the right treatments that will match
And
that
at the
up.
moment, you can do that through verbal discussion with someone in your online consults, like, because I know you'd access other like probably tools of tongue or
Yeah,
that kind of stuff. So do you still do that would you still need to do that in your online consults?
Yeah, I'm still looking at tongues. Yep. So I get people to poke their tongue out at me, and we because the tongue gives some really great clues. Yeah. So,
and I was just curious whether the way they describe is enough for you to work out what their type is or what their diagnosis is right now, or your physical assessment is really a very important part of your diagnosis.
Look, physical is really important, but we have to just do the best that we can.
Yeah, of course, right now. You're doing the best
at the moment. So I'm not able to do the pulse, and the pulse does give you some really good clues. But I find often with a good consultation, you'll take your pulse, and your pulse will just confirm everything
what you already worked out.
And really, it's only when you take the pulse and it doesn't do that, and you're like, what have I missed?
And I think that's the thing with trying to figure out something yourself, or working with someone who's literally already worked with hundreds or thousands of people already and done that. It's like sometimes people will say to me about like, well, do I need to go and have all those blood tests done? And oftentimes I will, like it will be good to see it. But there are some, I'm not saying every time, but there are a lot of times where the blood test is often used only to confirm what we're already like 99.9% sure is actually what's going on. And that's our experience of having heard a lot of people talk about symptoms and matching that up with a lot of blood work, or you like matching that up with a lot of pulse diagnosis. It only confirms what you've clinically observed and put together for years.
That's right. I find that I probably rely a bit more on observation through telehealth. So having a good look at someone's face, and I do miss palpation, hands on the body. However, I can ask someone. So today I was saying, when you touch up your upper tummy, what's the temperature like compared to your lower tummy? And then, do you have sensations in your body? Do you feel heat anywhere? Do you feel cold anywhere? Where is that? When does that happen? So I can get some really great descriptions from people on what they feel, which are not normally things they'd normally bring to their doctor and go, oh, I feel this weird sensation. But for me, I'm really interested in the weird sensations.
Absolutely. And they probably never felt that. Well, I don't even think that if you ask me without touching what's the difference in between the top of your tummy and the lower part of your abdomen, people wouldn't even be mindful of that.
That's it. Yeah. So we're looking
at so interesting. I feel like I'm learning heaps about Chinese medicine too. Okay, so before we finish up, is there any other really important tips that you want to share, or anything that we've kind of missed that you think is important for us to share about fertility or pregnancy, Chinese medicine right now?
Yeah, so I'd say at the moment we're in autumn. Autumn's all about storing, and we're heading towards winter. The weather has cooled down, and so we need to adjust our diet and our lifestyles to suit that. Now, everyone's a little bit different, like we've been saying throughout this whole session, and individual diagnosis will dictate a bit about how we do that. But generally, now is a time where we eat less sort of cold raw foods, unless there's a good reason for us to do so, and we go more into lovely cooked food. So if you're having a smoothie for breakfast, maybe now's a good time to look at things like porridges or eggs or something along those lines, or at least using a little bit of cinnamon or ginger in your food. So just, and it doesn't have to be overcooked when we say cooked. So it can just be light stir fries, or lightly blanching something, lightly steaming something, just so that it's not cold yet, but a little bit more easy to digest is good. We want the warmth going in. We want your uterus to be a lovely little incubator, and we don't want that to be cold. So starting the day with some warm water, or maybe some ginger in it or something like that, those sort of things. Thinking about warm, always having something on your feet, always keeping your lower back warm as well.
And this is for people generally, or this is really important for fertility and pregnancy?
This is people generally, but even more so important to because this remember, fertility is all about vitality, and when you've got good vitality, you know, oftentimes you're more fertile as well. If you're the things that promote good fertility in Chinese medicine also promote good longevity and good life, because it all comes back to these kidneys, which is all about your genetic material and your DNA. And if you look after that well, you should be able to have lots of children and live for a long life. Now, that's a generalization, and there's many different impacts on that.
Of course, yeah, of
but
course.
I think it's all about the sleep well, eat good food, don't stress too much, and generally live well, live with the seasons, go with the flow.
That's beautiful.
That kind of thing. Yeah.
There's a few people still watching here with us live. If anyone's got any questions, post them for me now, and I'll check in and ask you. But what I think I'm going to do is steal you again one day this week or next week or something. I can grab you and let's talk, because I think that the fertility and pregnancy side of thing is obviously really important. But I think trickling down through all of this right now is the impact that stress and perhaps not really good quality of sleep or all that kind of stuff is actually having on our bodies. And so it'd be good to, maybe we could put some ideas together of ways that, you know, things of people that can work on. So I kind of put you on the spot, but if you're happy to do that, I think that'd be good information for us to share.
Yeah, that sounds great. I'd love to do that.
Yeah. Okay, perfect. So I can't see any questions. Facebook has a bit of a lag. So if some questions pop up later on, I'll tag you and get you to pop in and answer them. But I'm just very grateful for my chance to learn a lot more today about Chinese medicine. And I think that one of our mutual patients commented yesterday and said she's just so grateful for us being able to work together. And I think that it is because we work differently, but in beautiful synergy to each other. And whether it's our little team working together or any other team, when you feel like you've got, particularly during fertility and pregnancy, that team of people that care for you on that journey, I think is really important. So you're a blessing in my life, because it's beautiful to be able to, you know, share the care of our patients together. So thank you.
Oh, look, that's my pleasure. I feel exactly the same. So it is just so lovely to work together with you as well.
Yeah. Well, thank you for your time. I'm going to pin you down and hold you to another chance to talk to.
Wonderful.
See you, Sarah.
Excellent. Thanks.
Bye-bye.
Bye-bye.